Hi, it's Patrik Hutzel from intensivecareathome.com, where we provide tailor-made solutions for long-term intensive care patients and where we provide tailor-made solutions for intensive care units whilst providing quality care, and where we save money for intensive care units as well. In today's video blog, I want to talk about the difference between palliative care in intensive care and intensive care at home. For those of you watching and listening to this who have a loved one in intensive care that are faced with palliative care or end-of-life care, where the intensive care team is basically suggesting to you that it's quote-unquote in the best interest for your loved one to die and have their end of life in intensive care, I'm telling you, think twice. A, did you know that 90% of intensive care patients survive? B, did you know that you can have intensive care treatment at home with our service, Intensive Care at Home? And C, did you know that you can also have palliative care at home? You can prolong your life at home or your loved one's life at home with services like Intensive Care at Home, or if palliative care is the only option, rather than having palliative care in intensive care, you can have palliative care at home. Some of our clients have been in palliative care actually for many years, and they live a good life at home surrounded by their family with 24-hour intensive care nurses at home. So whenever the intensive care team is challenging you with your loved one dying in intensive care, that this is the best option, they're probably telling you only half of the story. And they're probably only telling you from their limited intensive care mindset. Whereas we know both worlds. We know intensive care and we know intensive care at home, and we know what's possible. And by the way, we are providing a win-win situation for all stakeholders, which means we're providing quality of life or quality of end of life at home for our clients and for their families, but we're also providing a win for intensive care units, because we are cutting the cost of an intensive care bed by around 50%, and more importantly, we're giving intensive care units choice beyond suggesting to you that palliative care is quote-unquote in the best interest, because palliative care needs to be on your terms, not on the intensive care team's terms. And most families want palliative care at home, not in a sterile intensive care unit where, you know, there's other patients, there's infections, there's limited visiting hours, and the list goes on. The advantages of having intensive care at home, the list of the advantages is endless, and it's all there for you and for your family. We're also freeing up an intensive care bed that is in high demand, which again means we're providing a win-win situation for all stakeholders in intensive care. Intensive care beds are in high demand, and we help intensive care units freeing up their in-demand intensive care beds. This is Patrik Hutzel from intensivecareathome.com. Like this video, comment down below what questions and insights you have from this video, and subscribe to my YouTube channel. Go to our website intensivecareathome.com and call us on one of the numbers on the top of our website if you are interested in intensive care at home. Take care for now and have a great day.